So today we're going to switch gears a bit and we're going to talk pharmacology. We're going to talk nursing pharmacology. As you guys know, nursing pharmacology is a topic that I really like to talk about, and I want to do that for a couple reasons. First of all, what we do most of our time as nurses is pharmacology related, whether that's giving medications, getting medications, checking medication levels, or assessing vital signs before we give a medication. For example, checking a blood pressure before you give an ACE inhibitor, checking a blood pressure after you gave an ACE inhibitor, checking an EKG, running a potassium level, giving potassium. So much of our job is focused around medications. That's the first reason. The second reason is I'm more and more frustrated to hear of nursing schools cutting the pharmacology course or wrapping the pharmacology course up in a really quick method. That really bothers me, because what's happening with replacing that is we're moving our knowledge from learning pharmacology and being good at nursing pharmacology to other areas that, while important, don't put a patient's life in danger. So pharmacology, med-surg, those topics are where we need to be focusing our time, because those are the topics that if we don't understand well, if we don't do well, we can actually put a patient's life in danger. So that's why I think nursing pharmacology is incredibly important. Today we're going to talk about some of the most commonly prescribed medications in the US. I think it's important to know what the most commonly prescribed medications are, because if you have a patient come in with certain conditions, you can kind of expect what medications will be prescribed or what medications the patient may already be on. So being familiar with those medications that your patients are already taking, or those medications your patients are going to be prescribed, is important to understand. If you want to get this sheet, we actually have a cheat sheet built on this as well. If you go to nrsng.com/50meds, the number 50 meds, nrsng.com/50meds, you can get this cheat sheet. It's like 4 pages. It includes these medications, includes all 50 of these medications: generic name, brand name, drug class, indication, and then total US prescriptions. This is based on like data from 2014 or something like that. So important for you to understand. Let's talk about some of these medications, and we'll just kind of roll through the top 10 or so. And I want to see how many of these you're familiar with and how many of these you kind of know what they do. So what I'm going to do is I'm going to say the generic name. I want to see if you know the brand name and if you know the class and kind of what it's going to do and why we're going to give it. Okay, the first one is levothyroxine. Levothyroxine is a generic name for the medication Synthroid. The drug class for this is thyroid hormone, and we're giving it for hypothyroidism. So basically what we're doing in these patients who are hypothyroid, we give them this thyroid replacement hormone to try to stimulate or simulate what their thyroid would be doing on its own. Okay, what this thyroid hormone would be doing. So it's going to be given to kind of increase metabolic rate and help the patient in those instances where they don't have sufficient thyroid hormone. The next one we're going to talk about is Suvastatin. With Suvastatin, you should hear that suffix statin. And every time you hear statin, you need to be thinking that this is going to be for cholesterol, okay? This is going to be an anti-hyperlipidemic. So what that means is it's going to be given to try to lower our lipid levels, okay? It's going to be given for hypercholesterol. The brand name for this is Crestor. Okay, another brand name you might hear could be Lipitor. So these medications are given to help lower cholesterol levels. The way they basically work, real quick overview, high level overview, is they're going to inhibit cholesterol synthesis in the liver. So we usually give these medications at night because that's when the liver usually produces cholesterol, and so we give this medication before the patient goes to bed. And this medication in 2014 had about almost 23 million prescriptions. Another medication we're going to talk about is Esomeprazole. When you hear that prazole, remember when you hear the prazole, you're thinking proton pump inhibitor. Okay, I always remember that PR for prazole is like proton, PR and proton. So it's a proton pump inhibitor. The brand name is Nexium. The indication for this medication would be situations like GERD or heartburn. What it does is it inhibits gastric acid secretion in our gastric parietal cells. Okay, we have these parietal cells in our stomach that allow hydrogen release. That's the acid that's going to, cause the issues that we get with GERD and heartburn. And so what these prazoles do, what these proton pump inhibitors do, is they actually inhibit the release from those proton pumps of this acid in the parietal cells in the stomach. Another medication we're going to talk about is albuterol. Albuterol is a beta-2 adrenergic agonist. Okay, I know you're familiar with beta blockers. Beta blockers are going to block the stimulation that occurs from the activation of these beta receptors. What these beta-2 adrenergic agonists do is they actually have the opposite effect. They actually stimulate these beta receptors. So why would we want that to happen? Well, for our beta-2 receptors, what these do is these work to dilate our trachea, okay, bronchodilation, and that allows the patient to breathe better. So if you think, a fight or flight response, we're going to stimulate our beta receptors. In an instance where someone has asthma, that trachea is constricted, okay, or it could be spasming even. So what we do for these patients, we give them these beta-2 adrenergic agonists that actually stimulate those beta receptors, okay, and it actually allows for bronchodilation, allows the patient to breathe easier. All right, another medication we're going to talk about is fluticasone salmeterol. The brand name for this is Advair Diskus. This is a combination medication. There's a lot of these combination medications for our asthma patients. It's a combination corticosteroid beta-2 adrenergic agonist. So it has that beta adrenergic agonist effect where it's going to cause that bronchodilation, but it also has another effect with the added corticosteroid, which is a salmeterol. And what that corticosteroid does is it decreases that inflammation. So we're going to bronchodilate and we're going to decrease the inflammation at the same time. All right, and this medication had about 15 million prescriptions a couple of years ago, so really important medication. Now let's talk Valsartan. Okay, Valsartan. When you hear the sartan, you need to be thinking angiotensin receptor blocker. The reason we give the angiotensin receptor blockers are for conditions like hypertension and CHF. So just like every time you hear Pril or OLOL, Pril you're thinking ACE inhibitor, OLOL you're thinking beta blocker. Every time you hear sartan, you need to be thinking angiotensin receptor blocker. And these work along that renin-angiotensin-aldosterone system. They block the angiotensin receptors to help lower blood pressure. Another one we're going to talk about is insulin glargine. This is Lantus. Okay, I know you've heard of Lantus. And what insulin does, and you guys should be somewhat familiar with insulin, what insulin does is it actually works kind of like a key to the cell. Okay, so glucose can't get into the cell, provide energy to the cell, and will stay in the bloodstream if it doesn't have insulin. Insulin is kind of that key that opens the door to the cell and allows glucose to get in. We need that glucose, okay? We can't always just say that glucose is a bad thing because we need that glucose for energy production, okay, to create ATP, which is cellular energy. So we really need it for cellular energy, and to get it into our cell, we have to have insulin. That's what insulin does, and this is Lantus, pretty common medication given to diabetic patients. Let's talk one more here really quick. Let's talk celecoxib. Celecoxib is a common non-steroidal anti-inflammatory, or NSAID. Another name for this is Celebrex. So the brand name for this medication is Celebrex. But celecoxib, what it does, it's given a lot of times for rheumatoid arthritis or osteoarthritis. It's a pretty strong non-steroidal anti-inflammatory. And so what it actually does, it's going to inhibit the synthesis of prostaglandins, which play a role in inflammation, pain, swelling, all that. And so by inhibiting these prostaglandin synthesis, the celecoxib is actually going to help with that osteoarthritis and that rheumatoid arthritis and all that inflammatory conditions or results that happen from these conditions. So it's an important medication for these elderly patients or for anyone that's suffering from rheumatoid arthritis or osteoarthritis. And that medication, Celebrex, gets about 9 million prescriptions a year. These are just a handful of the medications that we cover in this 50 most commonly prescribed medications. What I would suggest doing is going over there and getting this cheat sheet. It's free. It's NRSNG.com/50meds. And I would kind of work through these. I would start with the ones you've heard of. before, and kind of the ones you've heard of before and you're pretty familiar with what they do, which is would go through and kind of make a check mark by each of those. The ones you've heard of but you're not sure what they do, I would make a different kind of check mark so you can go back and kind of learn deeper into each of those. Grab your nursing medication guide or grab 140 Must Know Meds, which is one of our books, and just kind of go through that with this book and kind of look up what each of these medications does. And like I said, I just mentioned that 140 Must Know Meds. That's a really great book to help you kind of understand what's going on with these medications and to give you a good kind of base knowledge of the most common medications. That is up on the website. If you go to NRSNG.com, you can find that book. But I would start with this 50 most commonly prescribed medications, which is free, and just start looking these up and seeing how familiar you are with them. Because once you get familiar with these most common ones, you're going to be more comfortable in what you're doing on the floor. You're going to start feeling more confident in your pharmacology knowledge. And I'm telling you guys, this is what we do as nurses. I mean, most of what we do as nurses is pharmacology. And there are all these checks, right? The provider writes the prescription, pharmacy checks it, we give it as a nurse, we're scanning things, blah, blah, blah. But that doesn't matter. Like, if no one else is at the bedside except for you as the nurse to check for side effects or to check for contraindications or to check for all these things that can happen with the patient based on medication administration. So as a nurse, I implore you, I plead with you, please get good at pharmacology. Okay, this is so important. It's one of the most important things that we do, aside from like our assessment and everything like that. I believe pharmacology is one of the most important things that we do, and it frustrates me, and I don't understand why schools are devaluing understanding and learning nursing pharmacology. It's so important. Okay, so start with this. I know we just went through some of these medications today, but this sheet has all 50 of the most commonly prescribed ones. And I think it'd be a huge help for you. That's at nrsng.com/50meds. I hope this was helpful to you guys. I hope, if nothing else, you know, just as you're driving around or as you're doing whatever you're doing today, that this provides some sort of assistance to you as you're preparing. So with that in mind, you guys know what time it is now. It's time to go out and be your best self today. All right. Happy nursing.